EGM Network.
Treasure Coast Connector. Connecting residents and businesses of the Treasure Coast. And here's your host, Ellen Contreras.
Welcome to Treasure Coast Connector. I'm your host, Ellen Contreras. This episode is partially sponsored by Libby Weissman and her team at SeniorTransitionNavigator.com and LuxuryHomesOfTheTreasureCoast.com. So Libby, she's a senior herself. She loves working with other seniors and their families, helping them make decisions to live their best life in their golden years. And she offers a lot of services like downsizing, decluttering, packing, moving, relocation, real estate sales, and more. For a free consultation with Libby, give her a call, 772-783-2800, or visit SeniorTransitionNavigator.com and LuxuryHomesOfTheTreasureCoast.com. Okay, do you feel like your spouse is ignoring you? Or are you noticing that a loved one's balance is a bit off kilter? Or are you ignoring and avoiding, I should say, going into crowded places because you can't focus on conversations? Well, joining me in the studio today is Dr. Alexis Riley. She is an audiologist. That's a hearing doctor. I didn't know that word, audiologist. Hearing doctor. That makes sense. Her practice is Trilogy Hearing and Audiology. She has a lot of great information to share about us being proactive with our hearing health. So welcome to the show.
Hello. Thank you for having me.
Yes. I wanted to use that fancy word audiologist, but you had to teach me that it was hearing doctor because that's what I know, But because there's a lot of really interesting things that I learned since getting acquainted with you that I bet a lot of other people don't know. And before we dive into the practice, I would love for you to share a little bit about your background. Why did you want to become an audiologist? And then start your own practice?
Well, yes, I love people and helping people. I worked in the service industry all through high school, and I actually was really involved in the theater. So I thought I was going to be a theater major, and that wasn't in the cards for me. I still am involved with the performing arts, but I took a hearing and speech, I should say, course in my undergraduate, and I just fell in love with it. It was just so interesting to me, learning about all the nuances of speech and hearing. It was just so different. My mom had been a nurse, and this was just a different dynamic, a different area to learn more about. And then I specialized in audiology for grad school. Yeah. Helping people hear better just seemed very rewarding.
Well, very good. And I'm sure that there's, I hate to say it this way, a lot of happy wives where the husbands are ignoring them, but we'll get into that later because it's usually the guys that put off like doing anything about it. But there are subtle clues, that one's hearing is on the decline. So if you can go into that would be very helpful because there were even some graphics about our brain health. And then I mentioned even balance. So if you can talk about what the subtle clues are about hearing decline.
Absolutely. So that is what is very complex about hearing, is that it is gradual and it doesn't physically cause us any pain unless there's an ear infection, but that's separate issue. So really just starting to increase the volume on the TV or the radio usually starts to happen first as our hearing begins to diminish. Maybe asking people to repeat what they're saying in social situations, especially in background noise. Yeah. Now, granted, we all have some level of difficulty. If it's really loud, everyone starts talking louder. We're relying on visual cues, but that becomes more apparent. Maybe if it's not so noisy, maybe asking the person next to you, what's the punchline? Everyone's laughing. Yeah. And maybe even some isolation can start to occur in family gatherings. If someone's not hearing well, maybe they're just not engaging. Or it could be the opposite, where they're getting a little aggressive. They kind of take over the conversation. So then they because maybe they're embarrassed if they are missing what's being said. But if they are taking over,
they're leading the conversation.
yes, that can be a sign as well.
Very interesting. And I remember years ago going out to the clubs dancing, and I would leave and my ears would be ringing for hours. That's not a good sign, is it?
Right. Well, that's could indicate some damage to the inner ear.
But I mean, like, hearing protection is a
Absolutely.
good thing. And we're going to get into that
Yes.
later on. But now what I'd like to talk about are hearing aids. We are bombarded with all sorts of, ads and commercials and videos and hearing aids that are super tiny and all of that. It almost feels overwhelming. It's kind of like the used car market with hearing aids. It's just very overwhelming. So how do you help people navigate that process? Let's talk about the hearing aids a little bit.
So yes, it can be very overwhelming. You're absolutely right. And that's why it's even more important to go to a trusted professional like an audiologist who can help navigate that and answer any questions. It is nice that because 1 in 7 Americans have hearing loss, and that number only increases with age. 1 in 2 over the age of 75 years old have disabling hearing loss. So again, everybody is getting into the business of helping people hear better, even if maybe they're not the experts in that. So the main thing that with over-the-counter type of a hearing device is that it may not fit appropriately, but it may bridge the gap for someone that maybe doesn't want to go into a medical environment to get help. So on one hand, I don't think it's the worst thing, but I do recommend at least talking to a hearing professional to have the ears checked, because it might be something as simple as wax buildup in the ear. And if you're then wearing a hearing device, that's only going to exacerbate, you may cause more damage.
Oh, interesting.
Even Q-tip use. A lot of us use Q-tips, but they're not made for the ears.
Can you believe that people, Cindy, use Q-tips for their ears? All right, I do too. Cindy and I are both agreeing to that. Are you saying that perhaps we should give that up?
Yes.
Okay.
Or there's a lot of other better ways to clean the ears, but our ears naturally clean themselves to some degree, protecting from foreign objects, bugs, etc. But with hearing technology, it is very exciting because in the last 10 to 15 years, really, we're much more able to help efficiently provide benefit in more challenging situations than we ever could before. But when they're digitally fine-tuned for the patient versus buying something online, it's usually going to offer a better experience and more satisfaction.
Yeah, see, I would never even do that. I would be so afraid. But I'm just afraid of, like, for example, like, yes, like there's so many options. So even when someone sits with you, there are a lot of different options. So you will help, people navigate that. So our studio audience of one, which would be Cindy, the production engineer, what about water in the ears, shower or pool? What about that? Yeah. How do we deal with that?
So some people, especially if they're prone to ear infections, which is more common in children, but not always. I mean, there's many adults, and water can exacerbate that. So there are custom earplugs that can be made for the ear that fit very comfortably, and they are floatable. Okay. So if you wear them in water and maybe they didn't get in correctly, it wouldn't be lost easily.
Okay.
And for a full-grown adult, it would be a one-and-done type situation because the ears are fully developed versus young children. To protect their ears, they may have to get them routinely as they grow.
Right.
So that would be the best way. And there's some inexpensive types of kind of putty that you can put in the ear, but a custom made would be more comfortable and just more reliable.
Yeah, I would be really afraid of, like I said, circling back to the whole hearing aid thing, just going on, I hate to say it, but like Amazon. Amazon seems to sell everything. I would not want to go that route, but I would want to see you.
Right.
But then it's like, how do you even decide where to begin with, what type of hearing aid?
Right.
So
usually my first question is asking what that person's experience has been with hearing aids, because that can sometimes be a deterrent. Maybe they had a parent or a grandparent that had these clunky big hearing aids and there was always a problem with the batteries. And it's usually just alleviating some of those concerns that might be a little scary. And, finding out or if they've already worn hearing aids before and been unhappy, what are they looking for differently? What's their lifestyle like? Are they concerned with vanity? Are they concerned with performance, like having connection to a cell phone with Bluetooth technology? That's really something that's provided a lot more benefit for phone calls. If someone that's working a lot of meetings, because it just transfers the sound to the hearing aids so they can be hands-free.
Huh.
Yeah.
I didn't even think of that.
Oh, yeah. So that's exciting. But again, even that may not be for everybody. Some folks may have a cell phone, but they only use it truly as a phone, which is weird these days, I know. But so it's just getting a case history, finding out exactly what the patient's needs are, and then adapting and customizing their treatment plan to what they need, because they can be made, the hearing aids, very small inside the ear. The most common type fit wrapped around the ear with a little wire. But both style options could work. It just depends on the hearing loss. And, but yeah, sometimes it's not all decided in one appointment, right? It's a big decision, and people want to be informed, but at least with your audiologist, it's the first place to start with those questions.
And then what happens if somebody decides on a hearing aid and then they realize, I'm not liking this, and then they want to go with another option they were considering? How does that work?
So state law in Florida, every state is different, but in Florida, it is a 30-day trial period that every person is given with hearing aids. So they have the option to either return or try something different. I offer 45 days because especially for someone that's new to using hearing devices, they may need a little longer to adjust. But there's definitely that time to ensure that they're physically comfortable, that we are meeting the needs of the hearing loss.
Yeah, I love that. I love that. And then what happens, like what advice do you have for the person that knows that their loved one is having a hearing issue, but the loved one is like, I'm fine?
Right.
Cindy and I both know some people in that category.
Well, and sometimes if the resistance is high, they have to have that acceptance. Because that's one of the first questions I ask, how motivated are you to get help if treatment is warranted? And if the motivation is very low, I try and find out why that reason is. Again, maybe they know someone that had a bad experience. Maybe it is denial. You just don't know. But that's over 50% of the success of a treatment plan. So oftentimes, maybe the wife or the spouse, the partner, the loved one will come in to have their own hearing checked. Sometimes that can help bring in their loved one. Because, the loved one may say that, oh, you have hearing loss too. You're the one not hearing me. So, it's a combined effort.
That's clever, though.
Yeah, so that's one way. But I think just education, that's why I'm trying to set myself apart with early intervention about protecting the hearing that you do have.
Yeah. So did you see what Cindy just did? She is asking us to take a break.
That was fast.
Yes. Before we do, what is your website and your phone number?
So my website is trilogyhearing.com and my phone number is 772-299-3506. All
right, perfect. Well, we have a lot more to discuss with Dr. Alexis Riley. Stay tuned. We'll be right back. See?
Well, it's that time of year. It's time for the Vero Beach Prayer Breakfast. Charlie Kirk's close friend and pastor, Rob McCoy, will be joining us to share his crucial insights. Also speaking is English author and theologian Oz Guinness.
The Vero Beach Prayer Breakfast will be held Thursday, February 12th at the Indian River County Fairgrounds. Tickets are selling fast at verobeachprayerbreakfast.com. That's verobeachprayerbreakfast.com.
Are you a therapist or a nurse seeking the multi-state compact license? In the state of Florida, these and many other industries require a Level 2 live scan background check for clearance to work in your industry. A1A Fingerprints is your certified live scan source from Broward to Brevard. And if you're a medical provider, you need to be registered on the ACA web portal. A1A Fingerprints will help you navigate and comply with the law. Call 772-494-6556 or visit a1afingerprints.com. A1A Fingerprints.
Healthy retirement starts at Treasure Coast Community Health. Short waits, easy scheduling, on-site services, wellness visits, chronic care management, and same-day sick visits. Call 772-257-8224 or visit tcchinc.org.
At Evergreen Media, we know the people, the businesses, and the work needed to take your marketing to the next level. We know where locals go to shop, work, and have fun.
We're here to focus on your local advertising so you can focus on your business. This is our home. This is our business. Evergreen Media. We market, you grow.
Welcome back to Treasure Coast Connector. I'm your host, Ellen Contreras, and I've been speaking with Dr. Alexis Riley, the founder and practice owner of Trilogy Hearing and Audiology. Just want to make sure. Audiology, that has to do with your ears, that $10 word that I learned like 2 weeks ago. Just kidding. Okay, so we were talking about, the problems that people have, right? But now I wanted to talk about noise level within the workplace. We have on the Treasure Coast a lot of manufacturing. Okay, we have a lot of logistics companies, aviation, sports. Like there's a lot of companies here where the noise levels could be a little bit intense. So what would you like to say about the hearing protection? Because that's another big service that you offer.
Absolutely. And that is, hearing protection is widely unused as a whole. Most people I talk to when I'm learning about their lifestyle and if they're still working or maybe in their past, they did not use regular hearing protection. Now, OSHA usually will come into these facilities, and if they're listening to 80 decibels or above for 8 hours plus, it's required. But again, landscapers, again, manufacturing, there's still a lot of
landscapers.
Yes. And there's so many vocations where hearing protection should be required.
Construction.
So we have to be, our own advocates. So as your audiologist, I can make you custom earplugs that fit very, very well. There's all different options, some where you can even still hear conversation, but it protects from impact, like if you're a shooter or a hunter.
The gun ranges.
Absolutely, yeah. And hunters, a lot of times you can still hear the animals and your feet as you're stepping through the woods. A lot of them will tell me they don't wear it because they're just shooting once or twice, but that is over 115 decibels. It can cause permanent damage, not deafness, but it can already cause permanent damage just from one shot.
Yeah.
So regular hearing protection, power tools, mowing the lawn really should be required. We should require it of ourselves, and that will protect the hearing because it catches up. Even loud concerts and all the crazy things maybe that happened early in life, it does catch up. Yeah,
I used to go dancing all the time. I used to when I was a young one 105 years ago. Now, preventative care, and this is important because I saw you have very good social media, really good education on your social media. So what do we do as far as preventative care?
So getting your hearing checked early. Okay. That can sometimes uncover some issues that may already be there that a patient may not be aware of. Maybe if you had a lot of ear infections as a child and you have scar tissue on the eardrum, you could be going through life as if everything's a little bit underwater. So getting a check, maybe you had it checked when you were younger but haven't had anything recently. I would really say anyone that's listening, if you haven't had your hearing checked, it's time. It's never too early.
Okay.
And then we can check the ears for wax. Some people are prone to just constant wax buildup, and we don't want to use Q-tips. That doesn't always get the job done.
No more, Cindy. We have to stop that. We'll give it up for Lent.
And I do offer wax clean, earwax removal. So some people are on a schedule of getting their ears cleaned yearly, and that also can prevent hearing loss because if wax gets impacted, it can cause hearing problems. And just getting a baseline. And then usually if hearing loss is diagnosed, I recommend a test minimally every 2 to 3 years. But if they already need hearing help but aren't ready for whatever reason, yearly.
Okay.
So just really staying on top of it is the best way. And especially if there's any dizzy symptoms or imbalance, it could be related to the inner ear since it's connected.
Oh, yeah.
So that's another... I don't treat dizzy problems, but I know when to refer out if it's related to the inner ear. So
okay, perfect. And then tinnitus.
Yes.
Tinnitus. That's what I was saying for
They're
years.
both correct.
All right, tomato. Fine. Very good. Now, what would you like to say about that?
So many of you listening may be experiencing this or have any annoying perception of sound in the ear. It can be ringing, chirping, rushing, roaring, crickets, static. Many of us experience it and it can be normal. A lot of times it will just cease on its own. But if it is something that continues beyond 3 to 4 months, I would recommend, again, getting your hearing checked. But if you do experience just on one side and it's of a sudden nature, that is really kind of more critical to get checked out sooner.
Okay.
It could be indicative of something medical going on.
Okay, interesting. And then, so in the first half, we mentioned your website and phone. I want to do that again, but your address, you are on Indian River Boulevard. You're actually on, the northeast corner of Indian River Boulevard and Royal Palm Point.
Yes.
Royal Palm Boulevard. Royal Palm Point?
It's Royal Palm Point and Indian River Boulevard. Yeah, 2750 Indian River Boulevard. I'm located inside of Florida Eye Institute.
Very nice. Yeah.
On the second floor. So
okay, yeah, you have a very nice office, and there's nothing scary in there. There is a thing that somebody sits in, and you're on the outside, and you do the hearing test.
Oh, the sound booth. Yes.
Yes, it's not scary at all. Just in case people are a little nervous. And then, what is your phone number again and the website?
It's 772-299-3506. And the website is trilogyhearing.com.
Okay, very good. And then, so what can somebody expect if they have never been to an audiologist before? Because I want to make sure people understand it's not like going to the dentist.
Right, correct. And this is...
I'm no longer scared of the dentist, though, Cindy.
I like the dentist.
Well, we'll talk about that after. But what can people expect about a first-time visit?
So again, a warm, welcoming environment, and we are just going to have a discussion, finding out what the patient is there to, what is going on exactly, a thorough case history, right? And then if warranted, if they want to get their hearing checked, or maybe they're wanting a second opinion on their hearing aids, I can take a look at all of that, give my professional opinion. But if we're going right for the hearing exam after checking the ears for wax, I have a little camera where they can see into their own ears, which is pretty cool.
Oh, wow.
Yes.
Yeah. Okay.
And then we go over the results and discuss if there is a treatment plan that's warranted, be it hearing aids or maybe a way to manage the ringing in the ears. There are ways to manage it. And we just go from there based on what they need. Maybe they want custom hearing protection. We would take a mold of the ear. Also for hearing aids, you can have a custom made mold for both styles of hearing aids, behind the ear or in the ear.
Yeah. Oh, I like that a lot. Cindy is telling me that we have to end the show. But you know what I want to do is I just want to say a quick shout out again to Libby Weissman, SeniorTransitionNavigator.com, LuxuryHomesOfTheTreasureCoast.com. She offers a lot of services for seniors to help them live their best life in their golden years. And you do the same thing. You help people live their best life when it comes to their hearing, because hearing well is not overrated. at all. So
Right.
I wanted to say thank you very, very much for being here. And for everyone, I'm looking at my time because she's going to cut us off in a few seconds. So for everyone that's listening and watching, my name is Ellen Contreras, host of Treasure Coast Connector. I hope everyone has a safe, wonderful, productive week. And until next week, I miss you already.